Tuesday Tips. Thank you so much for joining. This is our weekly check-in. We go over different topics in plastic surgery and I get to answer your questions. This month, we are focusing on massive weight loss patients. Last week, we talked a little bit about preparation for surgery for massive weight loss patients and what to do before, like diet, exercise, what to focus on your diet, BMI requirements, and pre-op workup needed for surgery. So now we're gonna go into more what's called body contouring for massive weight loss. And I love the term body contouring and not so much the skin removal surgery because it's so much more than just removing the excess skin. And the word body contouring really explains and really exemplifies that this type of surgery is not only about the removal of that excess skin, but contouring and giving shape to the body again. So with weight gain, we see changes in our body. Not only the elasticity of the skin is affected, but we also increase the intra-abdominal content. So there is fat around our organs, which is called the visceral fat. So when we gain large amount of weights, like a pregnancy, in the same sense as a pregnancy, the muscles tend to stretch out. So even when you lose the weight, you can have what's called diastasis of the rectus muscles, which is separation of the muscles. And that needs to be fixed. It's not just removal of that excess skin. To contour, most people say, I feel that I lost my waist. And that's because of that diastasis. The muscles are separated, and then you look more boxy. I have patients that we're not happy with the volume reduction on her breast after losing the weight. They're like, yeah, I didn't know I was gonna just lose my breast, lose my buttock. So body contouring offers options to regain some of the volume in areas where we didn't want to lose that much volume, but unfortunately with the weight loss we did. So I'll start with one of the most important aspects of massive weight loss body contouring procedures, which is what procedures can we combine, right? So when we gain a significant amount of weight, let's say 50, 100, 150 pounds, and then we lose that, there's excess skin in multiple areas of our body. We don't only see the abdomen, which is what people think. We can get the excess skin from the face, neck, chest, torso, the back, our extremities. So it is multiple areas that will need to be addressed most of the time. And most patients are like, I just want to get it done one time and get it done. So I can do the recovery one time and be ready just with one surgery. And that is ideal, of course, but the body needs healing, the body needs time, and there are some surgeries that are not best to be combined. So I'll go into what are the things that you need to be focusing on to decide which surgeries you can put together and which ones not. So basically two things, safety and recovery concerns. So safety includes time in the operating room. I try to limit the operative time to less than 5 hours. It has been shown in multiple studies that less than 6 hours in the operating room has significant decreased complications afterwards, including wound healing, infection, and blood clots, which include DVT or deep vein thrombosis and pulmonary embolism. And I'll go into those details a little bit later today. But 6 hours, and why then Dr. Vidal, why you say 5? Because I like to account for things that can happen, right? So I try to keep it when I'm planning a procedure less than 5. So if I take a little bit longer, something happens that I need to redo an area because I'm a perfectionist and I want everything to look perfect by the time that you wake up. So yes, there's some times that I redo things, that I stitch up and then I remove those stitches and redo it so it's perfect. And sometimes a planned surgery that was supposed to be 5 hours takes me 6, right? And I like to account for that. So I like to keep my planning on procedures that are less than 5 hours total time. Okay. The other thing, safety concern is the amount of incisions to heal. Okay, and also the amount of blood loss. When we add more surgeries, more areas, more blood loss, so the risk of needing blood transfusions and hospitalizations is higher. Okay, so that's in the safety area. and in the recovery area is we don't want to do two procedures that interfere with one another's post-op instructions. The classic example of this is the tummy tuck and the BBL. Both post-op instructions of these procedures are complete opposites. With the tummy tuck, I want you laying on your back, flexed. Literally, you're sitting in your butt all day during the recovery and walking, of course, but sleeping, sitting. And in the BBL, it's the complete opposite. I ask you to sleep in your belly, pressure in the tummy tuck area. So recovery instructions are very important to know which ones you want to combine or not, okay? And then if we're talking about which surgeries we can combine, then we have to talk about staging, right? So we do need, most of the time, for the majority of my massive weight loss patients, need to do more than one surgical intervention. It's more than one procedure, but not only more than one procedure, because we can combine multiple procedures in one anesthesia intervention, but also multiple anesthesia interventions to get them to their goal, okay? And it's important to understand that, okay? And to realize that it's in the best mind to keep you safe and to recover the best and to have the best results. Because in the recovery, if you don't take care of the area that you want to recover adequately, then we end up with complications and results that we're not happy with, okay? Then we end up with revisions, and revisions have a higher rate of not getting it right? Like if you want to get it right, you get it right from the first time type of deal, right? So safety and recovery are the ones that are so important. So understand that majority of massive weight loss patients will need more than one surgical intervention to treat all the areas of concern. So what are the most common combinations, right? So by far the most common that I do is what called the trifecta here at Pure. So the trifecta involves 3 areas, okay? So it's a mommy makeover, which includes breast or chest in males for gynecomastia, and tummy tuck, that's a mommy makeover or a daddy do-over, and they added brachioplasty, okay? So those are the 3 procedures: chest, belly, and arms, okay? I can do a trifecta in less than 5 hours. It usually takes me around 4 hours. So there are some patients that like to combine the trifecta with, example, face head to chin, something that is shorter, we can safely add it. And usually I like to have that one as the first procedure because I think it targets multiple areas that when you see yourself in the mirror, you see a big difference from before surgery to after. We're not just doing, let's say, the torso, but then you see the excess skin and the breast droopiness, and you're still not too happy about the result, or you're still like frustrated with you're not seeing a big change that you wanted to. And with the trifecta is so powerful that when you stand in the mirror, you see a big change in the entire front of your body. Okay, so I do this combination of surgeries very commonly, so commonly that I did one today. I do it at least 1 or 2 a week, I would say. So today, for example, was the massive weight loss patient. She wanted a reduction. After the weight loss, she ended up with an H cup. So she had neck pain, shoulder pain, so she wanted it lifted and smaller. So we did a breast reduction, arm lift, and extended tummy tuck in her case, okay? So very commonly combined. And then what would be the next procedure? Usually majority of my patients then address the back. And the back, it will depend where is the excess skin. With weight gain, the distribution of fat in each of us is very differently. There are some people that accumulate more fat in the upper back, others in the lower back, like in the thighs, bottom area. So if it's more in the upper back, then an upper back lift or a raw line back lift is the best. That can be combined with lipo 180 to the entire back. I've done it with combination of lipo 180 and fat transfer to the buttock to get some volume, because like I mentioned before, volume issues are usually around the breast and buttock, very common with the weight loss population. But if you were one of those that gained more weight on the buttock and lower body, then a lower body lift with the incision just in the bikini line, in the posterior back, lower back, transition from lower back to buttock. Basically lifts the buttock, and that can be combined with lipo 180 to entire back and fat transfer to add volume and shaping to the hips and buttock area.
You have a before and after with that case just
Yes.
recently.
So yesterday, if you go on my Instagram, there is a beautiful before and after. I'm super happy for her. She is a patient that I've done 3 surgeries already. At the time of that before and after, I had done 2. She had done a body makeover elsewhere. She wasn't happy with the breast. So the first surgery that I did was implant and breast lift revision. The second surgery was the lower body lift. In her case, she had no fat, 0. So I did what's called an auto augmentation. Basically, the easy way of explaining it is I don't remove the tissue in the upper buttock area. I kind of fold it in to achieve volume with your own tissue in that area instead of resecting it and pulling it up. So that's what the auto augmentation stands for. And then after that, that before and after that it's posted, she came back for the thigh lift recently. So those, she's still recovering from the thigh lift. She's super happy. So far so good. So stay tuned for those results in a couple of weeks. But yeah, so usually we go to the back and then the thigh lift. A lot of muscle weight loss patients, the main concern is the thighs. They're like, I can hide my belly, my breasts, the arms even, but I live in Florida, or I live in the in areas that I want to wear shorts and I can't because of the thighs. The important part of why I put the thigh lift always late or last is because we need to do the lower body lift first, okay? I have to kind of readdress the hip area in order to address the thighs, okay? So if you're massive weight loss, we have to address the back. So in this case, the second most common is the circumferential body lift. In this case, we address the back first, then we could do the thigh lift second, and then the upper body, or later. So thigh lift always after addressing the lower butt and buttock area. Willie, what's up?
We have a call.
We have a call?
Yes, we have a call.
Okay.
I think it's important.
Okay.
Okay, I'm
What's it about? I'm excited.
Let's see. Okay. Dr. Natalia Vidal is inviting you to go live.
Who is it? Really?
Okay.
There's actually someone calling.
Yes, but that's on your phone, and this is for you.
What's up? Hi, Sarah. So for everyone that is joining and haven't met beautiful Sarah, she is our post-op nurse. So if you had surgery already, you have already met Sarah. If you are coming in the future, then you will definitely meet Sarah at some point. She is our recovery post-op, and like she is actually our post-op manager. So she manages everything in the post-op team. So Sarah, what's up? Everything good? Yeah. Yeah. Yes, it's inspiring. So definitely the surgeries are inspiring. We love it. I wanted to for you to talk a little bit about seromas in this patient population that sometimes we see a lot, and we have developed a protocol that if you develop a seroma, you'll be kind of following up either with Sarah or Jenny, our nurse practitioner. So I wanted you to dive in and talk a little bit about that.
Si quieres me la pasa y la pongo aquí más duro. Just 1 second, Sarita, to put more volume here.
I tried.
Okay. Okay, let's see. Okay, go there. Better.
100% required for our massive weight loss patients that have tummy tuck procedures. The drains is a good indication of how much fluid is being produced by the body and how much the lymphatic system is able to handle. So there are two GP drains used in these types of procedures. Typically, our patients, when they reach 3 weeks post-op, we need to decide if it's worth keeping a drain in for the amount of fluid that's being produced, or if it's worth removing based on a higher risk of infection. So we take each case very specific, very case by case on how much your body is handling on its own. We start patients on a diuretic at 3 weeks post-op if their body isn't ready for the drains to be removed, if there's still too much lymphatic fluid being produced. This all comes together with what results in a seroma. So a seroma is a collection of that lymphatic fluid under the skin, most commonly after a tummy tuck in patient populations like ours.
Yeah, awesome. Thank you, Sarah. Thank you so much for joining.
Of course. Yeah, you're welcome. Thank you. Enjoy. See you soon.
Bye, Sarita.
So yeah, I mean, she put it perfectly. I couldn't have said it better. And it's usually something that may arise in the few weeks after surgery. But we have a good protocol on following up on these patients, adding diuretics to help with the fluid management. High protein, I can't emphasize on the diet. It's so important for wound healing, for your lymphatic system, for your kidney function. So it's super important to have a high protein diet in the post-op course. And like management of the seroma is important to avoid infection, but we do other things to avoid infection, like antibiotics and prevention, which includes, and that starts before the surgery with something called mupirocin, which is an antibiotic equipment that, yes, you put in your nose. I'm not doing nose surgery. It's body constraint, but you're putting it in your nose because the bacteria that we're treating lives in our noses. The other thing that we do before the surgery is wash our bodies with Hydroquince. It's a chlorhexidine-based soap that also gets all that bad bacteria that can cause infection off of our body before the surgery. And then during the surgery, I give you IV antibiotics. We prep, of course, the higher standards of infection control and sterilization in our operating rooms. We even use an UV light before you go, 5 minutes before you literally walk in the room to kill everything that is like flying around. And then, of course, you go home with PO antibiotics for a week, okay? So we do everything in our power to try to increase infection rates. My infection rate here is very minimal, less than what's reported nationwide for massive weight loss patients. It's never zero, but we try to keep it as low as possible. And the other one that we want to try to avoid is blood clots and pulmonary embolisms. Most important thing to try to avoid is walking. Getting up and walking is so important. It is hard after this body contouring surgeries, especially for combining procedures, but I cannot stress the importance of this enough. You have to make the effort, you have to get up and walk and circulate your blood. The other two things that everybody, like this one we do with everyone, is adding a sequential compression device that is battery operated. It's called Circulate or Venapro. You're gonna go home with that, you're gonna wear that for 2 weeks, and depending on your BMI, if it's more than 30 and you're having a tummy tuck, then I'm gonna add Lovenox, which is a blood thinner injection for 2 weeks as well, okay? And I just wanted to remind everyone my BMI limit, which is a common question, less than 33.5. I encourage everybody to go down to less than 30, okay? Any questions, Whitney?
Yes.
Yeah.
Do you give pain medicine after BBL?
Of course. I'm not a savage. I give you pain medicines, IV, and before you go, during the surgery and recovery before you go, and you're gonna have a prescription that if you do use our pharmacy that we have here at Pure, it's called Privicare. They're amazing, and they'll bring your medications. They'll send you a text message before your pre-op, so you can do the payment, and literally you'll have your medications when you come for your pre-op consult, so you don't have to be worried about where to find them, what pharmacy. I'm not from Miami, where to go. No, you'll have your medications here day before your surgery, so you'll have them ready for surgery day.
And came in a beautiful bag.
Yes, and it comes in a beautiful purple bag. Yes.
What type of arm compression do you suggest after an arm lift?
Good question. So you're gonna wake up with what's called an ACE wrap or an elastic elastic bandage. It's like a wraparound, okay? The reason for, why I don't use the sleeves from early on, I don't want to put stress on the incision early on. You're gonna wrap it with elastic wrap for that first week, and after, when you come for the follow-up at 1 week, that's when I'm gonna give you the sleeves. You're gonna be wearing your compression at all times for 6 weeks, and then from 6 weeks to 3 months, 12 hours a day.
Okay. Do you do not surgery if you are 35 to 36% of body fat?
So the percentage of body fat, I don't take into account. I take into account your BMI, so that's a different calculation. Percentage of body fat just differs in individuals. BMI is what literally every healthcare study and surgical study has used to compare to complications, and that's why I use BMI. So the calculation, you can literally go to Google, like BMI calculator. It's using your height and weight, okay?
An average 1 second drain ready for removal.
So my criteria for drain removal after body contouring is less than 25 cc's in a 24-hour period. If usually my patients have the drains for about 2 to 3 weeks. It is not uncommon that massive weight loss patients drain a little bit longer, and that's what Sarah was mentioning and explaining about the lymphatic drainage and massive weight loss. If it's a little bit longer, I've had patients up to 6 weeks. It is not common, very rarely, but that's been the most, but usually the majority 2 to 3 weeks, and it depends on that outline. Awesome, and Willie left me a little paper here that he wanted. You see, I remember. So he wanted me, to remind you guys about this special that we have here at the Pure Center with Jenny. Jenny is our nurse practitioner, injector. She's amazing, she injects me. So she's great, and we're doing a special, so you're ready for Valentine's Day with Dysport. It's only $399, so $399 for 3 areas of Botox, forehead, frown lines, and crow's feet. So take advantage. That's an amazing deal. So give us a call, book with her very soon, because it's not gonna last long. And the other thing is, I'm doing a media opportunity. I love my patient stories. I connect with your stories, why you decided to have the surgery done now, what's happening in your life, what you've been through, and what are your goals. So I would like to showcase a patient. So if you want to share your story, I would love to share it in my social media accounts. So there is going to be more information in my social media platforms, so check it out. And if you're interested, give us a call. Thank you for watching. I'll see you guys next week on Tuesday Tips. Thanks.